Hello, my name is Michelle McCarthy and I'm Professor in Learning Disabilities at the Tizard Centre, University of Kent. And in my work at the university, I focus on a whole range of issues related to people with learning disabilities, but my particular interests are working with women with learning disabilities in relation to their personal and private lives. And as part of that, I did a research project on domestic violence and women with learning disabilities, which I'm going to be talking to you about today. So my intention in this presentation is to give you an overview of the research that we did, and then to move on to thinking about how both health and social care professionals and those who work in the domestic violence field can better support women with learning disabilities who have experienced domestic violence. But just to say a little bit about the backgrounds to this work. Now, I'm sure you're aware that with regards to domestic violence and women in the general population, there is a huge body of literature, international literature, which kind of sets out the picture regarding women's experience of domestic violence. But there's much less research done on women with disabilities, any disability, really. But there was, before we started this research project, there was a small amount of research on domestic violence and women with physical impairments and sensory impairments. So it was important for us to be aware of that as a context for our research. And most of that research is done in the US and Canada, although there has been some research done in the UK as well, as you can see from this slide. But what that research tells us about women with physical and sensory impairments is that it's a common experience for women with disabilities, and the Canadian research suggests that women with disabilities are more likely to experience domestic violence than non-disabled women. And the UK research suggests that women with disabilities are often targeted by perpetrators as easy targets for abuse, and also that disabled women, despite their greater need, have less access to specialist domestic violence services. So that was the kind of general background. And that literature uncovered two things, really. One was that the types of domestic abuse that any woman can experience would also be experienced by women with disabilities. But then there were also some types of domestic abuse which were unique to women with disabilities because they related either directly to the disability itself or to the women's circumstances. So those were things like perpetrators would withhold or sabotage the equipment that disabled women needed, such as breaking wheelchairs, hiding hearing aids, that kind of thing. Women who might need help in with their mobility or being positioned in certain ways might be left for a long time in a physically uncomfortable position, or you know, an example, you know, leaving the woman sitting on the toilet all day, that kind of thing. And also that the perpetrator would threaten the woman with the idea that if she were to leave the relationship, that she would not only lose her children, but that she might herself end up in some kind of institutional care if she was unable to live independently. And I put this quote here by Ballon and Freya from 2012, because I think it kind of sums up what's going on for women with disabilities. And they said that abusive intimate partners exploit the challenges presented by the disability, knowing that that will seriously limit a woman's ability to take action. And that was in my mind when I started to do the research on women with learning disabilities. There was one small study on looking at women with learning disabilities by someone else, Walter Bryce and colleagues, and that was done in the UK. And that was a small qualitative study just of 5 women with learning disabilities who'd experienced domestic violence. And they found that the women experienced multiple forms of abuse, and a lot of it was severe physical violence, that the abuse and their harassment and threats continued after the end of the relationship, and that responses from either the police or social services to the women were minimal, and that the women felt that they were left unprotected, or the children were removed from their mothers. And after we'd started our research, we found another study. I think this one was from Australia, again, small qualitative study, just 5 women again. They found that similar things to the previous research, but they also said that the women in their study had all experienced rejection and difficult childhoods, and that they found a sense of belonging in adult relationships, even if those relationships were abusive. And they concluded that the low social status of women with learning disabilities increased their vulnerability. And then another study also came out in 2016, again, small qualitative study, this time 6 women, all women with learning disabilities. They found that physical violence was common and often at a severe level. Financial abuse was very common, as well as perpetrator-induced social isolation, and that there were some specific issues related to learning disability, and that perpetrators would kind of use that against the women. And as you'll hear in a moment, we found very similar things to all of these studies. So the research that we did from the University of Kent was, again, a qualitative study, so involved 15 women with mild and moderate learning disabilities. So again, a relatively small number, but as you can see, it's kind of 3 times the size of any of the others, and is still the biggest study, I think, involving women with learning disabilities. So their ages ranged from 20 to 67. They were mostly white British women. A few were married, but not the majority. About half had children, and we spoke to women in Kent and the South East, and also in London. And in terms of what we found, I think there are 2 stark facts which will summarise them, which is that there is nothing about having a learning disability which protects women even from extremes of domestic violence, and the full range of mental, physical, sexual cruelty which is inflicted on other women is also inflicted on women with learning disabilities. And sometimes people are surprised to hear that. So the women in our study spoke of severe physical violence. Some of the women reported very serious injuries, and those could have been potentially life-threatening. One woman had been stabbed, strangulation was involved, and one woman had been pushed downstairs and had head injury related to that. And weapons were sometimes also used. And I put some quotes here from the women that spoke to us. I'm not going to read all those out because you can read them, but I might just kind of summarise and paraphrase as we go through. So this woman said that he pushed me down the stairs and I was in hospital in a coma as a result of that. And another said, I felt really scared, but one day I'm going to end up in the coffin. So women did fear for their lives. As well as severe physical violence, the women spoke of it being a frequent occurrence and also something that went on for a long period of time. So I know it was every week. Can't be sure if it was every day, although for some people it was every day, and another said it was 12 years of abuse. In terms of violence during pregnancy, obviously, as I said at the beginning, not all of the women had children, but all of those who had been pregnant whilst they were with an abusive partner, all of them experienced physical assault whilst they were pregnant. And 2 women said that they miscarried babies after they had been assaulted by their partners. The women said that sexual violence was common. It's something that happened quite frequently. It sometimes happened either in front of children or when children were present in the home. But it was generally harder for the women to talk about. So the sexual violence, if they were asked directly about that, they didn't always say at the time, but during the long conversations that we had with them, they would reveal that this had happened, or sometimes they would come back to it. Financial abuse was extremely common, and the women described how the perpetrators would basically take all of their money. That was both their kind of regular income, which was generally from benefits. I don't think any of in our study worked, but the money that they had coming in regularly, but sometimes also savings if the women had managed to save anything, that would all go. And if they were reluctant to hand over the money, then they would experience an assault. Verbal abuse, also very common, daily occurrence really, that they would be insulted and called nasty names. And this, the quote that you can see on the bottom there, was a woman who was very distressed about the fact that her partner used to call her horrible names in front of the children. And she thought that her children had been really affected by that. She said, you think kids don't really understand it, but they do pick up on it, and it stays with them. And then there was what you might call psychological and emotional abuse, where the men were kind of either using the women's learning disabilities or their mental health problems to kind of goad them and insult them in some way. So the first one says, the woman who experienced mental health difficulties, he wanted me to kill myself. He used to try and provoke me into killing myself. And the other women who, with learning disabilities, would have that kind of used against them as a kind of taunt that you're useless, you can't do nothing. Coercive control was a feature of all of their lives, and the women described how they had to be very careful about what they did. The kind of walking on eggshells thing was very, very familiar to them, and that they had to, everything had to be about the perpetrator, I think is what they were trying to say. So, this first woman said, I just had to leave the baby to cry because he had to be sorted out first, the man. I wanted to take my son out, but no, everything was always about him. So the women's lives were controlled in many ways. And one of those ways, and one of the ways that the perpetrators managed to control the women, was by deliberately isolating them from their friends and family. And I'm sure this will be familiar to lots of people. But they did that in two ways. That they stopped the women from going to see their family. So you wouldn't even let me see my children once the kids have been taken into care. He said, get rid of their photos, your kids are not coming back. Not allowing women to go to work, to go out and see their friends. So there was that side of it. The other side of it, perhaps more subtle, although it ends up in the same way, is that the perpetrators would use various tactics to ensure that the friends and family of the woman would stop coming to see her. So things like being very rude or nasty to neighbours. I lost all my friends that way. He made it so I didn't have anyone to talk to. My oldest, kindest friends, he accused them of stealing, so they wouldn't come back here again. So the aim of it was to have the woman isolated so she would have no support. So in terms of who the perpetrators were, I mean, I need to make clear we didn't speak to the perpetrators ourselves in our research. So any information we have about them either came from the women themselves or came from those who had referred to professionals who had referred the women to our research project. And what the women said about their partners was by and large corroborated by those other people. So those were people like social workers, community nurses, psychologists. So the men themselves did not tend to have learning disabilities, although the women did. But they did tend to have other problems or issues, and those included mental health problems and or drug and alcohol dependency. A minority of the men also had serious physical health problems too, and that seemed to be significant because that was something that kept the women in that relationship, because they knew that the men needed help with their health issues, and they worried that if they were to leave their partner, that he would kind of struggle to manage. In terms of their kind of character or temperament, the men seemed to be very jealous and manipulative, and they would make threats of self-harm, suicide, or murder. including murdering the children. If the woman said that she was going to leave, then those were the kind of threats that would be made. They often had a history of abusing previous partners and children sometimes, and that the women knew about those, and that in itself was a kind of powerful piece of information, if you like, because if you know they've done it before, then you know that they're capable of it. Animal cruelty seemed to feature quite strongly, and as people will probably be aware, there is a clear link between animal cruelty and perpetrating domestic violence. And some of the men had criminal records and were known to the police already for various other things. So we spoke to the women about what happened, how they sought help, and what happened when they tried to get help for what they were experiencing in their relationships. And one of the things that we found, which I was surprised to find really, was that a lot of professional people, especially healthcare workers, were aware of the abuse that the women were experiencing. It was not hidden and it was not a secret. They knew about it for some time. But what seemed to be happening was that unless the women explicitly asked for help or explicitly asked for help in leaving the relationship, then really no action was taken on the part of the professionals. So people just kind of sat with that knowledge and waited for the woman to explicitly say, I want you to help me, or I need to get out of this. And so because that was a difficult thing to do, or perhaps the women didn't even know they could do that, is perhaps one explanation for why the abuse went on for a long time for some people. But the other thing that was very significant was a lack of accessible information for the women, that they were not, as people may well know, that adults with learning disabilities often experience problems with literacy, and so reading is something that is difficult, and sometimes people can't do that at all. And so information that was not in any kind of easy read format, or video information or audio information, there is lots of information out there for women who experience domestic abuse, but it was not accessible to them. And so a lot of women, for example, in our study, had never heard of a women's refuge, didn't know what that was. And so, of course, that they just didn't know those things existed, and would never ask about them. But where women did kind of actively report, as opposed to perhaps just kind of let it be known that what was happening to them, where they did report and did ask for help, then a minority of them reported having good experiences, either from as you can see here, as a social worker took me to a safe place, people were taking care of me, and another woman said that the police were really helpful and really good. So that was encouraging. But the majority of the women, I think it's fair to say, did experience problems in seeking help, and most of those seem to describe those to us when it came to the support that they got for their children, or rather the support that they didn't get in keeping their families together. So women said things like, when you ask for help, there's no one to help you. They seem to take your children away instead of helping you. And women also found that once their children had been removed from them, that they themselves then received no help at all, and they felt very abandoned at that point. And several of the women spoke about that. One woman, her daughter had been taken out of her care and placed with a grandparent, but had ended up living with the abusive partner, and she was very concerned about that. And when she contacted social services to explain that was going on, she found that she was just kind of brushed off by them. They didn't seem to want to know what she was saying. And another woman said, after my kids were taken away, I didn't know if I still had a social worker or not. I didn't know if I could get any help or support from anybody. And when she phoned up, she found the answer was no, not really, that she would be dealt with by the duty team just as anybody else might be. Some of the women felt that there was a lack of help available to them because of cuts to services. So they felt that because they were people who were, broadly speaking, relatively able and independent, that really there was nothing there for them, and that social services, social care services, could only assist people who had very high support needs. And people felt that support that they used to get, such as advocacy support, that's all been stopped because of cuts. And the third woman here that you can see, you can get counselling, but it's only 6 sessions, and that's not enough. So if we move on to thinking about, well, if women with learning disabilities are experiencing these kinds of problems, how can health and social care professionals perhaps help them? So there are a few ideas here, but I think the first and kind of fundamental idea is that domestic violence needs to not be thought of as an individual problem of that particular woman that you might be working with at that time. It's not an individual problem. It's a widespread social problem that has existed historically, still exists cross-culturally, and it's not really about that individual person itself. And I think if people can think about it as a widespread social problem, then it's helpful, because if you think about it as an individual problem, then the solution that is suggested to those individual women are, you can solve this problem yourself. You can solve this problem just by leave him, and leave the home is the implication of that very often. And that's a very unsatisfactory solution for a whole number of reasons, not least because, as the women themselves in this study were very able to say, leaving the relationship does not mean the end of the abuse. The abuse often continues after the end of the relationship. In fact, sometimes it escalates and gets worse. It's not a solution to the problem. And also, for women with a mild learning disability who have got their own homes, sometimes that has been a very difficult thing for them to achieve. And it's nobody wants to leave their home, but for some people it's a much bigger deal than others, because their chances of getting another independent home may well be slim. So I think it's important that we make links between the crime of domestic violence as is perpetrated against women with learning disabilities, to make links between that and other similar crimes against people with learning disabilities. So, for example, disability hate crime and what's called mate crime. Mate crime is the term that's given to where people kind of pretend to be friends of vulnerable adults, but with a view to exploiting and abusing them. Because I think the parallels are clearly there, and it might be helpful to think about that. And it's also very helpful, I think, for professionals to understand the factors which make exerting autonomy especially difficult for women with learning disabilities, both when they begin new relationships and during them. So that simplistic kind of, well, just leave, is often really not possible for a number of complex reasons. I think the other thing that's important is that health and social care professionals have a greater remit in working with those with a mild and moderate learning disability. And I know that's difficult to achieve, that there are kind of eligibility criteria for services, but if those people don't have anyone working alongside them and kind of keeping what you might call a kind of watchful eye and being there to talk to them and listen to what's going on in their lives, then those people are extremely vulnerable. Those are at the milder end of the learning disability spectrum. I think it's really useful for health and social care professionals to have far greater awareness about domestic violence and its dynamics, especially how coercive control will be operating in a relationship. And of course, the NICE guidelines should be followed, and they say very clearly that the managers of health and social care services should ensure that frontline staff in all services should be trained in recognising the indicators of domestic violence and abuse. And, as far as I'm aware, that is not happening everywhere, but it really does need to be. And if you are going to provide training in some of the indicators of domestic abuse against women with learning disabilities, then the research that I was involved in suggests that there are some kind of red flags that you might look out for. So if women with learning disabilities are in relationships with men who don't have learning disabilities, then that in itself, I think, is something to keep an eye on. I'm not saying that every man who has a relationship with a woman with learning disabilities is going to be an abuser. That's not the case. But unfortunately, there is a pattern of non-disabled men abusing women with learning disabilities. So it's just something that you need to be aware of and to keep an eye on. Not necessarily to kind of take any action or do anything about, but just to be mindful of. But then these other factors start to come into play. So if the man has no learning disabilities but does have mental health problems and drug and alcohol problems, then again, I think you can see that those red flags are perhaps getting a little bit bigger, and you need to be alert to what might be going on. I've put on this list men who don't work, and I'm not suggesting by that men who are unemployed are more likely to abuse than those who are in work. But by not working, that brings a number of stressors into the relationships, financial stressors, obviously. There's going to be less money in their household, and that might mean that the men are taking the women's money. But also, it means very likely that they're around a lot. So these men often move into the flats of women with learning disabilities, and they're there all the time. They don't go out to work, and so there's no kind of let up for the woman in terms of the kind of intensity of what's going on in the relationship. They're there all the time, and that can be very difficult. If the men move in with the women very early into the relationship, that again is a red flag. That was a very common pattern in our research, and it was often not something that the women particularly wanted, but the men would kind of manipulate the situation so that happened. And if you can see that a woman is becoming more isolated after she starts a new relationship, then that should be a red flag. If you can see that she seems to have less money than before she met him, that's a concern. And obviously, if there are signs of physical injury, then that needs to be a big red flag. But bear in mind that there is a likelihood of multiple forms of abuse. It's unlikely that someone is being physically injured without some other things going on in the background. So all of those are things to be aware of and to take note of. I think other useful things that health and social care professionals can do is to make women aware of relevant laws and how they might invoke them. So things like domestic violence protection orders, Clare's law, etc. None of the women in our study knew about those things themselves, and they needed somebody to tell them and ideally give them some accessible information about them. I mean, this next point is a big one, but it's important. That really, those who work in health and social care need, as far as is possible, to seek to improve the lives of women with learning disabilities in a broad sense, because women often have few social networks, no job, nothing in the way of adult education. There are not many kind of interests and activities in their lives. And if the importance of this is, if the only thing of value in your life is your relationship with your partner, then you'll be prepared to put up with an awful lot rather than lose that, because you don't have many friends, family connections, you don't have a job, you don't have money, you don't have other kinds of interests, and life can be quite empty sometimes and very lonely for adults with learning disabilities. So we should not be surprised that they want to cling on to the few relationships that they might have. And then, very importantly for health and social care professionals is to work jointly with domestic violence specialists and the police. I appreciate that that's very difficult in the current climate, because cuts and cutbacks to services to all of those services make that very difficult. So adult social care system has been in crisis for a long time. ADAS, the Association of Directors of Adult Social Services, has warned that cuts have made the system unsustainable, and that this was, by the way, before COVID pandemic, which has clearly made life more difficult. The system was already on its knees anyway. Clearly, the cuts to domestic violence services and refuges also make life very difficult, as do cuts to the police service. So I'm not suggesting that it's easy for people in any of these services to do that kind of joint working and with the strains and stresses that they're working under. But nevertheless, I think it is really important. And the reason that it's important is because learning disability specialists can't really reasonably be expected to be domestic violence experts, and those who work in domestic violence services or the police can't really be expected to be learning disability experts either. So you need to work together to provide the best kind of service to women in this situation. I think in terms of those who work in domestic violence services, what they can do to make their services more accessible to these women are to reach out to learning disability services, so to advocacy services, to self-advocacy groups, women's groups for those who have learning disabilities, parenting groups for women with learning disabilities. There are lots of those kind of services and groups meeting throughout the country, and just reaching out to them to tell them about domestic violence services would actually be a really useful thing to do, because chances are there will be women who use those services who would benefit from that information, if not now, then in the future. And you can just perhaps plant some kind of seeds of information that people might retain for if and when they do need it. And very importantly, you need to provide accessible information. Any written information that you provide needs to be in an easy read format with kind of easy read words and some pictures to help understanding. It's very important not to forget your websites when you're making easy read information, and people often do. They might provide a kind of easy read leaflet and then forget that the information that they provide online also needs to be made in an easy read format. And there are lots of examples of easy read information and websites out there on all sorts of different topics. So it's pretty easy to kind of find some and have a look and then adapt your own material accordingly. Also, video resources have proved to be very useful with women with learning disabilities in this position. And I put a link on the screen there for a video that I made as a result of the research project that I did a few years ago. That is for women with learning disabilities, to explain to them quite what domestic violence is and what kinds of support they could get from a range of services. The other thing that domestic violence services can usefully do is to make sure that they connect with the few specialist learning disability and abuse services that exist around the country. There aren't many, but there are some, and so it's important to draw on their expertise. I've just listed a few here. Beverly Lewis House, which is in East London, is the only specialist refuge service for women with learning disabilities in the country. Maybe even the world, I'm not sure. And so obviously they're very experienced in working with women in this situation, so you can draw on them. The ARC Us2 project, that is a project that's running currently in the Southwest, and they are doing lots of great work actually on peer-to-peer education for women with learning disabilities and autism around domestic abuse, but also doing training for staff who work in a whole range of different services. So I would certainly encourage people to look at that, and they will be producing some materials at the end of their project as well. So it will be good for you to make contact with them. Respond, some people might have heard of that. Respond is a organisation based in London, long established. They provide psychotherapy and counselling services to adults with learning disabilities who've experienced a whole range of different issues, trauma, but certainly domestic abuse is one of the things that they do, and sexual violence for sure. And then SARSAS, the Somerset and Avon Rape and Sexual Abuse Support Service, which used to be called Bristol Rape Crisis, I think. They're a general rape and sexual abuse support service, but they do have a project, especially working with women with learning disabilities to support those women. And again, they're producing some materials, so good people to make contact with. Okay, so I think I've come to the end of my time. There are some references there that I referred to in my presentation, and then this is a list of the publications and resources that arose from the research project that I worked on. And those are my contact details. If anybody wants to make contact, then that would be great. Obviously, during the pandemic, I would say don't phone because there's nobody at the university. So email is the best way to make contact. And I look forward to taking any questions and having a bit of a discussion later. Thank you very much.